Hello, I'm Wendy Busby. I'm a geriatrician. I'm one of the consultant physicians in the internal medicine service.
I'm Margot Love. I'm charge nurse of Ward 8B, which is an internal medicine ward here at Dunedin Hospital.
My name's Alice and I'm a physiotherapist here in acute medical and in the stroke unit.
So what does early mobilisation mean? It's more than walking. We need to think about simple things like just getting out of bed and getting into a chair. You know, that's important. People do better and recover their independence faster just by getting out of bed and not lying in bed all day and sitting in a chair. It improves their balance. Well, actually this applies to everybody, but you can imagine if you're in your early 20s probably lying in bed when your function's up here and this is a level where you can't mobilise. If you dropped 5% or 10%, you're still going to be independent. But we're particularly looking at older people. We're particularly looking at people who've often got some pre-existing problems with their function. They might already be using aids to walk with. So it's applying to everybody, but particularly for the older patient, whatever older means, because you can have incredibly fit 80 and 90-year-olds, but it applies to them too. With this too, the other spin-off is, as people get out of bed, start mobilising in around the ward, it helps people to orientate in terms of where they are. It helps to decrease the rates of background confusion, because often coming into hospital can be quite a frightening experience for people. People can become disorientated. So it helps with that too. It also increases the amount of socialisation and interaction that patients have with other staff members. So overall, people usually feel good about doing this. So what we know is that even after one day of lying in bed, an older person can lose up to 1% of their strength, and with that, their balance becomes impaired. So if they therefore spend 3 or 4 days lying in bed, suddenly they've lost 4% of their strength and their balance, which is going to put them at increased risk of falling over.
As part of the day for the nurses, they get them sitting up in the chair for their meals, try and get them sitting up as much as possible, and then the physios along with the nurses get them mobilising as much as possible and regularly so that there's not the muscle wasting.
Of course we need to talk about walking, going to the toilet and doing daily tasks of themselves, like being independent with personal care, showering and bathing, rather than just being more passive and getting nurses to do things. So obviously with this, nurses are a linchpin in terms of what's happening. Encouraging independence sometimes can take a bit of extra time, but if we put that investment in early on in patients' admission, we know they're going to do better. Mobility is a big issue here, and so we need to be working as a team, and we're particularly looking at involvement with our physiotherapists, our occupational therapists, and again, nursing staff, linchpin in what's happening.
The key things are to have some good footwear, to bring clothes in or have family members bring clothes in, and to be hopefully engaging with the staff in the hospital to get moving. I think the key messages are to be moving early, because that makes a big difference to your recovery in the end.
Earlier return home, earlier recovery of independence, and less complications.